I'm very glad to be here for many reasons, except apart from the warmth and the friendship. I'm happy to be in one of those few pockets somewhere in the globe where communities are gradually recognizing the value, its own value of being communities. Somehow over a particularly over the last century, but particularly over the last half century, the communities all over the world seem to be breaking up, and we are becoming more and more nuclear, contained in small pockets without any relationship with the external world except through the television screen. And that has numerous consequences, of course, on the health of the individual as a whole. And I believe by encouraging community participation in healthcare, we palliative care people are doing something more than compassionate care in the presence of diseases. I believe we are doing more than healthcare in the community. I think we are creating a different world, a world full of friendship and compassion. Uh, if we were having only three palliative care centers with involvement of the community, I would not have been courageous enough to say this, but I have seen how communities grow and how they have grown across a whole state in India, and I am really hopeful for the future. But before I start, let me thank my friends Mike Hill and Sue Hill, who created the movie The Hippocratic, who have been doing palliative care movies one after another. This is their fourth movie with the theme of palliative care. With they find it hard to find funds to create these movies, but they are doing this for global advocacy for palliative care. They have the reason why I could be here with you today, and I thank them. I also, he was very happy with the outcome of the screening yesterday when I informed him and wanted me to convey to you that anybody who wants to obtain the movie, of course, we still have discs available for sale, but online purchase is possible, and anybody who wants to pick up a couple of the cards so that you can access the movie will be welcome too. I'll leave them here. Let me tell you a little bit about the background in India where I work. There are a lot of us, 1.25 billion plus and growing fast, 1/6 of the world's population. The good news is that many things are improving. GDP is improving, but the inequity in wealth is also increasing. The rich are becoming very rich, and with the amount of wealth we have in the country, I am ashamed to say that we still have 1/3 of our population living below the international poverty line. Maternal mortality is declining, infant mortality is declining, almost on par with USA now. That's great. But the suffering, health related suffering, is also increasing, unfortunately. Pain doesn't get treated, palliative care is available despite all our efforts for a quarter of a century for less than 2% of our population. Unfortunately, that's not only India. You'll find it hard to believe that is a story for 85% of the global population. Many of you have worked abroad, you have worked in Africa, some have worked in Nepal, in some countries, but including those pockets, the people who have access to palliative care still remains less than 50% of the global population. That's the sad part. In my own country, our National Crime Records Bureau report that every year more than 26,000 people commit suicide for health-related reasons alone. That is not only pain and suffering, it is also financial destruction. Again, some of you may be surprised to learn that except in that 15% of the global population, treatment costs are mostly out of pocket. If I fall ill, it's Chandriya's responsibility to find enough money. They will ask for this scan and that scan and this intervention and that intervention, and families get wiped out. The next generation also gets destroyed. This car that you see on the screen is not a very unfamiliar sight to me. This particular man had numerous investigations, and they thought they would operate on him. It was not cancer in his case, it was a peripheral vascular disease. His blood vessel had got blocked. The pain was so agonizing that he tried to hang himself. In his struggle, he kicked the tall stool that he stood on to hang himself from the ceiling. His two children, something like 12 and 9 years each, heard the noise, came rushing in, picked him up and lifted him up and saved his life. They screamed and neighbors came and brought him down. One of the most painful things that I've ever seen in my life, in my palliative care work, was the sight of the man actually touching the feet of the children and begging for forgiveness. Because he realized what trauma he had caused to him, and those children must still be living with those scars because the man died anyway. You know why? He did not get opioids. He went on taking non-steroidal anti-inflammatory drugs, so that his kidney got destroyed and he died of renal failure. No, these are stories that happen all over the world, or 85% of the world. We come to your country and learn all the technology. We take back the machines. Great things. They are very shiny with all those lighted bulbs glittering all over the place. We love technology. We take them back. We don't take back your social workers. We use those machines to cure a lot of people, I am happy to say. But we use those machines also to inflict suffering on a lot of people. And that's happening all over the developing world. And paradoxically, because of that, very paradoxically, the poor seem to die better. I may not spend the time to tell the story of the elderly woman, but that woman who was living in an orphanage, in a poor home, at least got her daughter with her for the last 5 days. She had some drops of water down her throat when her throat was parched, and she died with the daughter's hand on the forehead of the woman. But everybody who has some money in the pocket, like that man there, gets imprisoned in an intensive care unit, even if it's advanced cancer or any incurable disease. The medical system considers it duty to keep having the heart beating indefinitely as much as possible, at an enormous financial and emotional and social cost to the patient and family. And by the time the man goes, the rich family has become a poor family.